afternoon, Sally. How are you?
I'm not too bad today.
Good, good. My name is Alia. I'm one of the emergency doctor. I will look after you today.
Okay.
Yeah. So can I ask what brought you into hospital today?
Yeah, I've been having a lot of chest pain over the last few days, and my daughter got very worried about me and called an ambulance.
Okay. And can I ask how many days you have, like when the chest pain started exactly?
About 3 days ago.
3 days ago.
Yeah.
And it's been constant chest pain or on and off?
On and off.
On and off. Okay. And when the chest pain has started, it started suddenly or gradually?
Gradually, and I've got the shortness of breath when it happens.
Okay. And when it started first time, what you were doing, can you remember?
Just having a cup of tea.
A cup of tea. Okay. And can you point where's the pain?
Just here in my chest.
Just here.
Yeah.
Okay. And can you tell me how it's look like? How can you describe it? Is it heavy pain, like something sitting on your chest? It's sharp, squeezing, dull pain?
Dull.
It's dull pain.
Yeah.
Okay. And when it comes, it lasts for how long?
Not too long.
Not too long. Like
a
few minutes. Few minutes. And when it goes suddenly, like by itself, or you need to do something, take some medication to make it go?
No, I haven't had any medication for
so
it.
it's self-resolved by itself?
It's still going. That's why my daughter's brought me in here,
Okay.
because it's getting, like I'm getting sort of sharp
But
pains.
for 3 days, been all the time there? Or you have episodes? Yeah, so when I mean it goes by itself. And it comes by itself.
Yeah.
Yeah, okay, no problem. Can you tell me if it goes to your both arms, neck, jaw, back?
No.
So it's just here, localized pain.
Yeah.
Yeah, okay. Can you tell me which things make the pain worse? If you move, if you talk, if you walk, if you breathe?
Just breathing and just generally,
yeah. So if you take deep breath, do you feel it hurts? Can you try? It hurts. Okay.
It does.
And if you press on your chest, do you feel it hurts or doesn't?
No,
it doesn't affect. Okay. Anything make it better? Did you try anything? Breathing deeply?
I haven't tried anything.
Any painkiller? Anything?
No, I haven't taken anything.
Okay, no problem. And 1 to 10, how much you give to the pain? 1 is very little, 10 is very severe pain.
Quite severe enough for my daughter to be worried to bring me in here.
Yeah, like 5,
Maybe
6,
7, 8.
7, 8. Okay. And can I know if this the first time you have this chest pain or you had it before?
No, I don't have any heart problems.
Never had chest pain, so this is the first time in your life you have this chest pain. Okay, can I ask you if you have any shortness of a breath with the pain?
Yeah, a little bit.
Shortness of breath. Okay, do you have any lightheadedness, dizziness you feel?
Not really.
Not really?
A little bit.
A little bit, okay. And it doesn't...
Gets a bit tight in my chest.
Yeah. Now?
Yeah. And my daughter was so worried.
Okay. Yeah. And do you have excessive sweating?
No.
With this pain? No. Any nausea or vomiting?
No.
Any episode about to faint or pass out?
No.
Nothing. Okay, that's fine. And can I ask you, do you have any high blood pressure, history of high blood pressure?
Yes, I've got high blood pressure.
Okay, and how long you have this problem for?
Couple of years.
Okay, 2 years. And you've been follow up with GP or heart doctor regarding this?
GP.
Blood pressure, GP. And you on regular blood pressure medication?
Yes.
And you've been taking it regularly every day?
Every day.
Yeah, okay, that's good. And can I ask you, if you have any high cholesterol or high lipid?
Yes, I've got high cholesterol. I think the main issue that I'm feeling is a lot of heart palpitations.
Okay. Yeah, so you feel your heart is racing?
Yeah,
okay.
Beating quite fast.
Very fast, okay. Just want to ask you about these things and I'll come back to this, okay? So do you have any like history of ischemic heart disease, heart attack, anything like this?
My mum,
Yeah.
she died at 86 of a heart attack.
86. Okay, yeah.
My brother, he's got a stent put in his heart.
Which age? What age?
He's 2 years younger than me.
Okay, yeah. All right. And from your father's side, no issue?
Not that I know of.
Okay. Do you smoke?
No.
Drinking alcohol?
I do have a glass a day.
Yeah. Okay, that's fine. Of wine? Or?
Yeah, wine.
All right, no problem. And for your heart racing, I just want to ask you how long you've been experiencing this issue with your heart racing?
A couple of days.
Couple of days. Okay, started. And can I ask if it started suddenly or gradually? Like out of a sudden you feel your heart is
Suddenly,
racing? Suddenly. And this is the first time you have this heart racing, or you had it before?
Yeah, first time.
First time, first episode. And when it comes, it was all the time there for 2 days, or it was on and off, on and off?
On and off.
On and off, okay. And when it comes, how long it lasts?
Couple of minutes.
Couple of minutes.
Yeah.
Yeah. Okay. And does it stop suddenly when like it comes, or it takes slowly when it's like
It's hard to tell.
That's fine, no problem. And can you remember if anything make the palpitation, the heart racing worse or better? Nothing.
No,
Nothing.
I can't think.
Okay. And and just wanna ask, do you have like any problem with your heartbeat in the past? You feel you have irregular heartbeat or
No, I think
skipping?
it's been okay.
Okay. Have you done before any echo, any ECG, any device, we call it Holter monitor, put it for?
No.
No, nothing. Okay, that's fine. Never had this. Have you ever seen any heart doctor for any heart issue?
No.
Nothing. Okay. Otherwise, you've been fine, healthy. Any medical issues? Do you have
High blood pressure.
high blood pressure?
I have some medications that I take for that, and cholesterol. High cholesterol.
Yes. Okay. Have you ever have a problem with your thyroid?
No.
Nothing. Okay, no thyroid problem. And do you have any new stressor or change of your lifestyle or anything make you a bit anxious or worried or stressed?
No.
Okay, no problem. And can I ask you a few questions about your medication?
Sure.
So which medication you are on?
I think Coversil.
Coversil. Yes.
Somac.
Yeah. Do you know the doses or not?
I think 10 milligrams in the morning.
Morning. Okay.
And Somac and statin.
Yes. Somac, how much you take?
Can't remember, but my daughter
That's
can
fine.
show you the script.
And the statin.
Statin, yeah.
And you know the dose or the name, or you don't know?
The name?
Yeah.
No.
Yeah, that's fine. No problem. And how long you've been on statin for?
A couple of years.
Okay, will be blood pressure medication. And you compliance with medication, taking it regularly every day? Okay. Do you have any allergies to food, to medication?
No.
Okay. Just need to know more about your social situation. Okay, so I'm just asking who lives with you at home?
Just me by myself.
By yourself. Okay. Do you have any friend, family around?
Just my daughter. She's about half an hour away.
Oh, okay. And she visits you regularly?
Yeah.
Any neighbors, anyone close by?
Just to say hello to you know.
Okay. Any services at home you have with cleaning, shopping, personal care?
No.
Nothing. And how you mobilize usually?
Just with my walking stick.
Okay. And are you independent in daily activities? You do everything by yourself?
Yeah.
You look well, and that's good.
I look after my skin.
Yeah, of course, you look so bright, and movement make you keep like going healthy. Yeah. Okay. And you said you are not smoking.
No.
Doesn't drink.
Just
alcohol.
a drink of wine a day.
A wine a day. Okay. Any coffee you drink?
Just a little.
A little.
cup of tea and coffee. Maybe
Every
one
day.
a day.
Yeah. Okay. That's fine. And like pet at home? Would
Any
you
what?
pets? Like
No,
pets.
just me.
Okay, that's fine, no problem. And other than that, I've just got all the information. I just need to do some examinations. I'm
Okay.
gonna listen to your chest, to your
Okay.
heart, feel your pulses. We're gonna do like some full set of temperature, blood pressure, and we will check for your breathing and everything.
Okay.
Because you have chest pain as well,
Yeah.
we need to do chest x-ray just to make sure there is nothing make this feeling.
Okay.
Okay, you accept with that?
Okay.
Yeah, and we need to do ECG to see if your heart is like normal and there is no
Yeah,
issue with that.
Yeah, okay.
Yeah, we'll put.
I think the nurses have done an ECG before you came.
Yeah, that's good. Yeah, sometimes we need to repeat the ECG within half an hour, after half an hour, just to make sure there is no changes. And we're gonna put a line on just to make sure you have access whenever we need. We'll do some blood tests, including the heart enzyme. We call it troponin. This shows us there is any problem in the heart if it goes high. Yeah. Sometimes we repeat it, but you have it for 3 days, so it might we need to do one. And also we will give you some medication, including like aspirin. Loading dose, we give it 300 milligram just to make sure you are safe if there is any problem. So we give it to every patient. It's our like. Disease.
So Alia, this is the ECG of this patient.
Yeah.
Can you tell me what the ECG shows?
Yes, so I can see the ECG. I could not see any ST elevation in this ECG. It looks like fine for me, though there is no ischemia or something. And from the heart rate, I can see she has a regular heart rate because it shows that there is maybe AF because her heart rate is 124 and it's a regular beat.
Yep.
So my suggestion is the patient has a new onset of AF, atrial fibrillation.
Okay, all right, thank you.
No worries.
Now you want to talk to the patient about how you're going to manage her condition now?
Yeah.
Okay.
Okay, no worries.
Thank you.
That's fine. And sorry, before. Hi, Sally.
Hello.
Yes, so we got all the result of all the investigation we have done today, and the good news, you don't have any heart attack, and your blood test looks totally fine, and your chest x-ray is normal as well.
Oh, good.
So we're happy with that, but the thing is you have another issue, we call it atrial fibrillation. So I will explain it to you, but don't worry, you will be fine. You are in a safe place and we will look after you. You will get the treatment and everything and you will be fine. So it's a serious issue, a serious condition, sorry, but we will treat it and you will be fine. But if we want to treat it, it will be serious, and I will explain to you why. So the condition you have, we call it atrial fibrillation, when your heart is beating so fast, more than 110 or 20, and you have 124 beat per minute. So this is quite fast, and also the ECG shows your heart rate is not regular. So this is the concern. That's why we call it atrial fibrillation, when your heartbeat is not regular, and we need just to do some more investigation to make sure there is no other reason makes this heart rate irregular. And also we will start you on some medication to prevent any clotting or anything, because irregular heartbeat, there is a side effect of it, make a clot, and maybe it will travel to the brain and it will cause a stroke. But we give the medication, we call it anticoagulant. It's a blood thinner medication, and we it's like a prophylaxis medication to prevent from any clot. And
is that its name?
It's, we have different names of it. We call it a blood thinner, but we have quite a few, like Clexane, we have Ilcus, we have warfarin. It's different. We have warfarins need regular check, but the new one now doesn't need a regular blood check, and we can give it to you as a treatment, and you will be safer from blood clot. And also we will give you some medication to control your heart rate, so you will be safe. And also I can refer you to a heart doctor just to for regular follow-up with him, and he can do echo for you. He can do stress ECG, whereas the treadmill you can just, if you're pain-free, just to see everything is fine. And also he can put the Holter monitor to see, like the device for 24 hours to measure your blood pressure and your heart rate to make sure that everything is fine. Okay.
Is there any side effects on the medication?
Yeah, of course. So there is some side effects of the blood thinner. It makes the blood very light, and the if there is any bleeding, it won't stop like before.
Okay.
Yeah. So and also we can give aspirin to make sure. Aspirin is not a blood thinner. It's a blood thinner, but in a different way. It makes the platelets less. So you know, when we bleed, the platelet, we have platelet in the blood comes and build as a wall to our skin, so it stops the bleeding.
Okay.
Yeah, so we give those two. We need you just to make sure that you don't have a fall when you walk. You be very cautious.
So
with
can I go
walking.
home when I get the medication?
Yeah, of course.
So I'd like to go now, soon.
Yeah, just before you go, I need to talk to the cardio team, the heart team here, just to make sure they're happy for you to go home on aspirin, blood thinner, and we can book on an urgent appointment with outpatient clinic with the heart doctor, so they can look after you as long as you don't have any heart attack or anything. And from there, they will look after you on a regular basis. Just you need to be compliant with your medication as you take a blood pressure and cholesterol, and you will be safe and fine. Don't worry about this. And just try to relax, avoid alcohol at this stage, and avoid any coffee, just to make your heart rate going down. Try to go for a walk exercise and do a breathing technique, relax. You can do meditation here to relaxation music, and all will be helping with your heart rate. And yeah, don't stress out, because stress make the heart rate worse. So just keep calm and everything will be fine with you. Okay? Yeah, just make sure you be cautious when you walk. If you have bruises, don't worry. Sometimes when you hit yourself, you did not notice a bruise before, but maybe with this medication you will have mild bruise, so don't worry. This is a side effect of medication and it will be self-limiting.
Is it every day I take the medication?
Yes, it will be every day, and most of the new blood thinner, you need to take it 2 times a day, in the morning and in the afternoon, but the aspirin, it's just 1 time a day. Okay? Yeah, and aspirin is over-the-counter medication. You can take it whenever you want from the chemist, but the blood thinner one, we need to give you a script. We can give you some here, and when you go home, I can write the letter to GP, so he can start you on this, and he will give you the script for ongoing treatment.
Okay, thank you very much.
No worries, my pleasure. Any other questions before you go? I go to talk to the heart doctor?
No, that's fine.
All
thank
good?
you.
Everything is clear?
Yes, thank you.
No worries. Nice to meet you.
You too.
Yeah, I will
Thank
be
you.
back to you to let you know the final plan.
Okay,
Yeah,
thank you.
you.
My name is Dinaka, one of the ED consultants.
Okay, nice to meet you.
So today we have done the mini CEX examination for you. So we are assessing you on history taking, management and counseling. Okay.
Yeah.
If you don't mind, can you summarize what was the presentation and what was your diagnosis and how did you manage this presentation?
Yeah, okay, so I got 74-year-old female here with new onset, first time onset of chest pain for 3 days, associated with shortness of breath, mild dizziness, and palpitation. So she does not have any history of any ischemic heart disease or any heart problem. Just she has history of high blood pressure. She's on regular antihypertensive medication, and just suddenly started with chest pain.
Sorry to interrupt you.
Yes.
Can I ask you, what's your diagnosis?
Okay.
And what was your management plan for this lady?
Yeah, so from her observation, I saw the heart rate was 124, and her ECG, there is no ischemic changes, but shows irregular heartbeat. So my diagnosis was atrial fibrillation.
Excellent, very good. Yeah.
And my management plan was, the first thing is to reassure the patients, because this is the most important thing. She was quite stressed about her situation, especially she lives alone. And I explained to her that she will be safe, and we will start her on some medication to prevent the complication of AF, and also to follow up with heart doctor, and we'll call the cardiology team here to just give the final plan if she can go home, because she was keen to go home, and to follow up us on outpatient with the aspirin, anticoagulant, and just heart rate. Yeah.
Very good, very
medication.
Good. That was very good. So Aliya, so overall, this station or this assessment, you have passed this assessment.
Thank you.
That was good.
Yes.
So what we'll do is, with the feedback, we need to give you some feedback on how you went through this mini CX and how we can make ourselves a better clinician. That's what it's all about, this mini CX and this WBA program is about.
Yeah.
Is it okay? Can you give you some feedback of how you did the station?
Yeah, of course.
Okay?
Yeah.
All right,
I
thank
need
you.
to hear from you. Yeah.
With the history, it was very good. So you asked for the presenting complaints. It was good. You elaborated the presenting complaints. And then you did the Socrates, that was excellent.
Yeah.
You asked about the chest pain, about the nature of the chest pain, the radiation, etc. That was really good. The only thing is that the main presentation was that she came in with some dizziness and was having a funny spell.
Yeah.
Okay.
Yeah.
And she was, if you looked at the orbs, she was tachycardic, but her blood pressure was fine, her sugars were fine, her saturations were all good.
Yeah.
So the most important thing when we think a patient is coming with palpitations, always think about whether they got a tachycardia or a bradycardia.
Yeah.
But in the situation she was having a tachycardia. Okay, that was good. So you also very good identified about the chest pain.
Yeah.
And you said that you're going to give her some aspirin. That's very good. So that's a preventive measure to make sure there's. And you asked about whether she was in any obvious discomfort. So you wanted to give her some pain relief. That was also very good. So then you went through the different history, like her past medical history, her medication history, her allergy history, her social history. Another history that was very good. It was extensive, but it was very good at everything. Okay. So let's coming back to the ECG.
Yeah.
When I asked about the ECG, so do you got a template to how to read an ECG?
Yes, I have, but not very good.
That's all right. It's always a good time that we can go through
course.
it.
Yeah.
So any ECG that we always look at, go through the rate,
Yes.
the rhythm,
Yeah.
okay,
Yeah.
and then look at your ST segments,
Yes.
and then look at your intervals
Yeah.
and your durations, and then you can determine what is this ECG, and then you also need to look at the axis also. That completes the ECG.
Yeah. Okay.
So if you have that structured template,
Yeah.
next time you look at the ECG, it will make a bit more
Yeah,
easier.
of course. Yeah.
It was very good. You diagnosed the ECG as atrial fibrillation. That was good. But next time, if you have a structured approach for that, that will be
Of
much
course.
appreciated.
Yeah. When I got it now, it's clearer in my mind.
Yeah.
Yeah.
So for atrial fibrillation, do you have any clinical decision rule for her management?
Okay. Just if it's acute or recurrent, and what I know, we can just give some medication to control the rate, and also some preventive for aspirin, anticoagulant.
Excellent.
and follow up with the cardiologist for Holter monitor further investigation. Yeah.
So in Sally's situation, so she was having the palpitation for the last nearly 3 days.
Yeah.
Okay, and it was intermittent and we're not sure how long
Yes.
it lasted for.
Yeah.
So in her situation, given it's been there for nearly more than 48 hours,
Yeah.
and we're not sure about the exact onset, so
Okay.
better we go towards more of a rate control
Yes.
rather than towards a rhythm control.
Okay.
Okay. So before that, we need to, you said about anticoagulation.
Yeah.
Do you have any clinical decision rule for anticoagulation at all?
Yeah, there is.
Okay.
Yeah, there is, but yeah.
It's called as the CHATS-2 VAS.
That's too vast. Yeah, I have it in
So
my.
if you look at MD-Calc,
Yeah, I
or
have it in my.
so then it will give you the score whether this patient needs anticoagulation or
Yes.
not. Next time when you see a patient
Yeah.
with atrial fibrillation, use the CHATS-2 VAS score. That's
Okay.
important.
Yeah, yeah. I forgot about the beta blocker.
Yeah.
I know. Sorry for that.
That's okay. That's all right, because the cardiology
That's right.
registrar or the senior ED person would have advised you on this.
I know.
But you did everything. So when the patient said that they
Yeah.
wanted to go home, you said that she's safe enough to go home. You ascertained her social situation. You ascertained her well-being. So you were happy for her to go home. But you safety netted her by saying that you're going to have a chat with the cardiology team
Yeah.
and then get back to her.
Yeah, of course we need to make her heart rate low with like
Excellent.
maybe beta
Yeah.
blocker, metoprolol
Yeah.
or anything before we discharge her home. Yeah.
Yeah, I like your approach. It was making the patient very comfortable. Sally, when I was looking at Sally felt very comfortable. You were going in a very calm and slow and steady. So that made the patient really happy. So that's what we need. So that's what you did. You did extremely well. And you gave very good counseling about the side effects of the anticoagulant. So, and you said you can easily bruise, you can easily bleed, you need to be a bit careful. If you have a fall, it can bleed. So you did extremely well. So all the counseling regarding the anticoagulant was excellent. So next time when you come across a similar situation, think about like a beta blocker,
This is
all right,
nice.
or whether they need a rhythm control,
Yeah. Of
and
course.
then you can have a cardiologist chat with the cardiology or the ED to see. where
Yeah,
to go.
you know, I've seen so many like palpitation from my previous job. The first things I need to do is just make their heart rate low, but maybe because I concentrate, she's AF and yeah.
No, you did well. You did very well. From a WBA perspective, for this mini CEX station, you passed it very well.
Thank
No
you.
issues or anything.
Yeah,
about
thank
it.
you. Just the beta blocker next time.
Excellent, very good. So it's all for a learning. So you have some learning points from this
Of
station.
course, of
So next time when you're going to see a patient with a similar presentation,
Yeah.
so you're going to get the CHATS mask, you're going to get your medications and everything.
Yeah, yeah.
All right.
Yeah. No
Thank
problem.
you. Thanks for coming for this mini CX today. You got any questions for me?
Oh, thank you so much, doctor. It was a pleasure to do this and nice to meet you.
I will do the feedback and assessment on H prime.
Yeah.